dermatitis, and it causes the skin to be inflamed or irritated, which causes it to look red like that picture. And other conditions usually develop along with it, like hay fever or asthma. Some symptoms of it is dry skin and itching that increases at nighttime, and red to brown gray patches that usually is in the hands, feet, neck, upper chest, and eyelids, and the bends of the elbows and knees. But then in infants, it can also be on the face and scalp. It's also small raised thumbs, and these can leak fluid and crust over when they are scratched. It also causes thickened, cracked, scaly skin, and it's raw, sensitive, and swollen from scratching. Some causes of it are food allergies in children. Some of these allergies can be like dairy products, eggs, or like soy products, and many more. And it's a gene variation that keeps the skin from retaining the moisture it typically uses to protect people from the bacteria, allergens, and irritants. And this causes the skin to be affected by environmental factors. And so it's an overactive immune system, and it also can be caused by dry skin and different irritants like metals, cigarette smoke, soap, perfumes, and many others that you see there. And so the assessment is you need to determine if there's a family history of dermatitis or itchy skin lesions, dry skin, asthma, or hay fever. And so when you're looking at during the physical exam, you need to look for itchy skin lesions and skin thickening. And in acute cases, lesions that may be seeping of serious fluid. In less acute cases, the lesions are just scaly. But then in dark skin patients, lesions may appear to have a lighter pigmentation. So the diagnosis, generally no laboratory testing is necessary, but they can take a swab of infected skin, which may help with the isolation of specific bacteria in the infection. And a physical examination is done, which looks for the itchy skin and lesions and the redness. So treatment, the most typical treatment is moisturization and topical steroids. So these can be prescribed in different strengths, varying from very mild or to very strong. And people with this condition often benefit from like lukewarm baths with oils, different oils in it, and but anything that dries or irritates their skin may be a triggering episode. So they can also be given antihistamines for severe itching. So the prognosis and follow-up, this is not life-threatening, but it can bring about seriousness of quality of life because of the itchiness, and it can be painful. If the medications aren't working that you're prescribed, you may have to go back into the doctor's office and talk to your physician about alternative medications that you can use. And those are our sources.